Hi, it's Paul Sackers, Good News Broadcast, speaking to Dr. Tina Groat. Hi, doctor. How are you?
Good morning.
National Medical Director of Women's Health Line of Service for United Healthcare. Tell us a little bit about United Healthcare. I know it's a very large and wonderful organization.
Right. United Healthcare is one of the largest health insurance companies here in the United States.
Okay. And so health and living longer and living it in a nice way is all good. And the doctor's going to talk about born too soon. Okay, here's an interesting, I guess, reality out there. As a number of elective deliveries, elective ones, okay, remains high, so do the risks to mother and baby. Okay, what is an elective delivery?
Sure. Well, what research has shown is that many expectant mothers are choosing to deliver their babies a little too early. An elective delivery is a delivery that's done not for a medical indication. Most women have a normal pregnancy without any complications, but some women may need to schedule their delivery. They may need to come into the hospital for a C-section or come in to have their labor induced, which is, giving medications to start the labor process. What the main OBGYN professional society, the American College of OBGYN, or ACOG, what they have said is that elective delivery should not occur before 39 weeks. And the reason for that is that babies born electively prior to 39 weeks have increased risk of complications.
Why would somebody do this?
Well, we think that many women don't realize the importance of those last couple weeks of pregnancy. United Healthcare actually did a survey of first-time mothers, and what we found is that 92% of women believe that it was safe to deliver before 39 weeks. Once again, the main OBGYN professional society, ACOG, has said that elective delivery should not occur prior to 39 weeks.
Yeah. So, their doctors, you would think, wouldn't be suggesting this, right? So, are they not listening to them?
Well, the American College of OBGYN has been really clear in their guidelines. And the reason for that is there's been data to show that babies born electively prior to 39 weeks have increased risk of respiratory problems and increased risk of infection. Those babies can be up to twice as likely to end up in the neonatal intensive care unit. And so that's why it's important for a mother to talk to her obstetrician about her particular circumstances so that she understands what's going on with her pregnancy and really discusses the risk and benefits to both her and her baby.
Now, let me ask you another part of this here. Will hospitals take somebody prior to where they also might think it might be too soon?
Sure. Many hospitals are actually putting in policies around when people can schedule their deliveries. And the important thing to note is that most women, have a normal pregnancy without complications. However, some women may have a medical reason requiring an early delivery. The key thing is that elective deliveries where there isn't a medical indication, those shouldn't occur before 39 weeks. And the reason for that is the baby's brain and lungs really are growing those last couple weeks of pregnancy, and so they're actually very important.
It's comfortable in there. Why do I want to get out so soon?
Well, right. Inside the uterus, the babies are growing and developing, although mothers are quite uncomfortable. So you've got to balance both mothers and babies.
Oh, geez. Okay. Boy, this is this is actually a little bit of a shocker for me, to be frank with you. And it sounds like, in essence, concerning news, but the good news, though, is that we're letting the world know about it. Is this something, would you say, that is prevalent more here in America than maybe other countries?
I'm not sure about other countries, but what I do know is that here in America, there are definitely, many elective deliveries. There was actually an article in the January 2009 New England Journal of Medicine, and what they found is that over 35% of elective repeat C-sections were performed before 39 weeks. And those babies were up to twice as likely to have breathing problems or end up in the neonatal intensive care unit. And so this definitely is an important issue, and that's why United Healthcare really wants to get the word out to women to really talk with their obstetricians about their pregnancy and the risk to both mom and their newborn baby.
Yeah, no, this is wonderful. This is very honorable of the organization coming out to talk about that.
Well, fortunately,
Jeez.
we do also have a website where women can go for more detailed information. Our website, www.healthy-pregnancy.com, is a resource that we have, put out there so that women can learn what are the questions that they need to ask their obstetrician about their pregnancy and delivery, and also they can find out some pictures and more information about the baby's development.
Doctor, would somebody do this because is there some monetary reason to do this earlier?
I can't speculate on why people are choosing elective deliveries prior to 39 weeks. What I can say is that it definitely does pose risk to the infant, and so that's why it's important to consider both what's going on with the mother and also what's going on with the infant as it's growing inside the uterus.
Well, thank you very much for sharing this important information. And the website is United Health.
The website specific about pregnancy is www.healthy-pregnancy.com. And there's a lot of great information there, good questions that women can, help, because sometimes it can be hard to know what to ask your physician, and also a lot of great pictures that show how the baby's growing and developing.
Okay, well, thank you very much. This is this is the kind of something that should be on the front page of the newspapers also, because this is I'm a grandpa, so as you're telling me this, I'm saying to myself, geez, boy, this would be this not so good. So, thank you very much for sharing the good news by knowing about this. Even the March of Dimes says the message is simple. Please don't schedule a C-section prior to 39 weeks unless it is medically necessary. Okay, Dr. Groat, thank you very much.
Great. Thank you for having me.
Okay, bye-bye.